Right, so this the title that I was given, the topic that was given for this lecture is SMBG in Ramadan, a necessity or a luxury. Right, it's going to be a very straightforward lecture. We'll try to follow the timeline, Rohana. Right, so if you look at the self-blood glucose monitoring or self-monitoring of blood glucose, we know very well that good quality of glucose information is core prerequisite for successful diabetes management. And it will help us and people with diabetes to make medically relevant decisions on therapy. And routine monitoring of blood glucose is recommended so that we would able to understand the glycemic state of the patients, to enhance awareness of the effects of lifestyle modification and adaptation of treatment that was given is given to the patient, and to enable documentation of intraday pre and postprandial glucose excursion. And of course, if the patient complains of symptoms of hypoglycemia, then the glucose monitoring will be able to confirm the presence of hypoglycemic episodes. So what are the reasons for monitoring? Usually, we would want patients with diabetes or people with diabetes on controlled meal plan, such as they have a certain medical condition that we want them to really restrict their diet to monitor blood sugar so that they don't go into hypo. And similarly, for religious reasons like fasting Ramadan, we would want them to monitor blood glucose because of the same reason. And for whatever reason, risk of hypoglycemia is also pretty high in those with renal dysfunction and on anti-diabetic agent, whether insulin or oral agent. If they're taking other concomitant medications that may interfere with blood glucose profile, elderly patients with diabetes, especially if they stay alone and they on multiple medications again, they may have risk of hypoglycemia. And of course, use of any glucose lowering medication in diabetic patients, we want them to monitor to look at their control of blood glucose and also to detect hypoglycemia. So when we talk about Ramadan fasting, Ramadan fasting can precipitate dramatic change or changes in meal schedule and also sleep pattern, and it then can be associated with certain risks of these changes. So the risk due to the pathophysiology that disrupt the normal glucose homeostatic mechanism. Usually they will eat 3-4 times during daytime now because they want to perform Ramadan fasting, then they would not be able to eat during daytime. So it's very important to monitor the blood sugar during this time. And of course, to ensure people with diabetes so that they are able to fast safely, they need to be vigilant in checking blood glucose level. And once the pre-assessment be done, education be done, once they are allowed to fast, blood glucose need to be checked several times a day because levels of blood glucose fluctuate significantly when body enters into a fasting state and of course after they break their fast. I just want to share with you, this is the mean continuous glucose monitoring profile from healthy subjects before and during Ramadan. So this is a study on 7 healthy volunteers. The red line is when they during fasting Ramadan, and the blue line is the non-fasting period. So you can see that the main change during Ramadan fasting in this healthy subject is the fluctuation in blood glucose, especially just before iftar, the blood glucose drop slightly more and increase tremendously after iftar. And if you look at the fasting and non-fasting during the fasting and non-fasting period, based on CGM, there's no significant changes in the mean interstitial glucose or the mean amplitude of glucose excretion or MAGE. And if you look at mean CGM profile from patients with diabetes, so about 56 of them before and during Ramadan, you can appreciate here during non-fasting period, the blue line, there's not so much of fluctuation in blood glucose, but if you can appreciate during fasting period, the fluctuation is noted even more. And similarly, just before iftar, that the blood glucose dropped tremendously and increased right after iftar. And again, there's no change or significant change in the interstitial glucose and also a MAGE based on this study. This is another study in the Asian region from Indonesia, looking at 10 type 2 diabetes subjects. Mean duration of diabetes about 3.9 years, baseline A1C of 8.8%, and CGM was done 2 weeks into Ramadan and a month after Ramadan. And again, in this study, they've shown that there's no difference in MAGE value and as well as in the interstitial glucose fluctuation during Ramadan fasting. You can see during just before iftar again, the dot here, okay, this line during fasting period, there's reduce or a dip in the blood glucose just before iftar, while during the non-fasting period you can see that the fluctuation in blood glucose actually pretty not that much difference. And if you look at the activity during fasting or non-fasting period, essentially the same. And if you I can show you again the blood sugar, the variability of blood sugar is notable during fasting period. And that is the reason why monitoring is necessary in fasting Ramadan in people with diabetes. And we also know from a lot of studies that there are several risks associated with fasting in those who have diabetes during Ramadan, mainly hypoglycemia because of decrease or irregular food intake together with the use of anti-diabetic medication. And of course, hyperglycemia is also pretty common due to excessive glycogen breakdown, increased gluconeogenesis, and reduced doses of anti-diabetic medication. Of course, associated with it, hyperglycemia will be dehydration, also ketoacidosis. So back to why the monitoring is important. Again, hypoglycemia is pretty common. If you look at the EPIDIA study, there's increased risk in hypoglycemia by 7.5-fold. In CRIT study, 8.8% of hypoglycemia during Ramadan, 9.8% of increase in hypoglycemia in digestion Ramadan International Prospective Study, and in Dar type 2 study, the hypoglycemia is also very common during Ramadan, 10.4%, whereby in type 1 Dar study, there's not much difference between type 1 and type 2. So when do we monitor blood glucose during Ramadan, or when the patient is fasting during Ramadan? Is just before dawn or during sahur, mid-morning, midday, okay, before in between, just before either just before breaking the fast or before iftar, or if let's say they feel tired or they worried about their blood sugar, they can also monitor between midday and before sunset, 2 hours after breaking the fast. And of course, anytime when there are symptoms of hypo or they're feeling unwell, they can monitor their blood sugar. So what are the blood glucose target? So if they monitor blood sugar or they check their blood sugar before sahur, it should be between 6 to 8, mid-morning between 7 to 10 millimole per liter, and midday between 6 to 10 millimole per liter. Before iftar, it should not be below 4 millimole per liter, and 2 hours after iftar, it should not be above 10 millimole per liter. And the other study that I would like to share with you is the blood glucose monitoring timing in patients with type 2 diabetes. This is a study that was performed in 139 subjects. It's a cross-sectional study. A structured questionnaire and interview was done. And you can see that all these patients, they will be either on metformin, combination with SU, metformin and insulin, and also insulin therapy. So if you look at this graph, majority of the patient will monitor their blood sugar during pre-iftar time or just before iftar, about 56.8% of them, or they monitor blood sugar when they have symptoms of hypoglycemia. Post-iftar, only about 29% check their blood sugar, and rarely check the blood sugar in the afternoon or after midday and before break their fast. And despite that, only about 10% monitor their blood glucose on the daily basis based on this study. And patients who had symptoms of hypoglycemia, in this study, they have to break their fast at least once, about 41% of them, and about 27% had to break their fast, and about 41% had symptoms of hypoglycemia, but not necessarily that they have to break, they actually break their fast in this study. So once the patient monitor their blood sugar, the next thing to tell them is when to break the Ramadan fasting. So they should break their fast if blood sugar or blood glucose is less than 3.9 millimole per liter, and to recheck if it's between 3.9 to 5 millimole per liter an hour later. If the other reason why they should break their fast, if the blood sugar is too high or hyperglycemia of more than 16.6 millimole per liter, or anytime if they have symptoms of hypoglycemia, dehydrated, or the feeling ill, despite the normal blood sugar, they should not continue with their fasting. They should break their fast. So it is necessary, just to conclude, it is necessary for all people with diabetes who wants to perform Ramadan fasting safely to check their blood sugar or to monitor blood glucose, because by monitoring blood glucose will help them to educate on what type of foods that's suitable to take during iftar, during sahur, and also to teach them or to guide them on how to adjust the insulin dose or other oral agent based on blood glucose level during fasting, and to also guide them whether they should continue with fasting or they have to break their fast during Ramadan. I think that's all my slides. Thank you very much.